if it should turn out that these outcomes trials that we're going to be seeing in a couple of years really do dramatically lower heart attacks and strokes, I would imagine that there'll be some more clamor for a wider population to use them, and the initial price tag on these is over $14,000 a year. That's way above statins. So I'd like to talk about sort of what we can do about pricing, and we're going to have, this is going to be part of the discussion in the presidential campaign. It's already started. Are you concerned that insurance companies will try to limit the use of these drugs if we think that patients should get them? And do you think there's any, whichever of you, do you think there's any chance that either the drug companies or the government will figure out a way to rein in these costs so that people who need these drugs can get them?
So Bill, I'm happy to begin that discussion, but I want to make sure we tie to the video the right way, because otherwise we'll leave, I think, the wrong impression. This was a very important video. Patients who have these genetic conditions, FH, are underdiagnosed, and educating the public, just like Frank is talking about educating the public about what they actually eat. We as the cardiovascular community need to do a better job educating the public about the family history issues here. But understand how rare that was. Very, very important, but there's one genetic condition that runs about 1 in 300,000, and that's when you inherit both bad copies from mom and dad. And the other is running 1 in 300 to 1 in 500, where you get one of these genetic problems from either mom or dad. That's what that was about. Right. And no doubt about it, these new drugs on top of statin therapy are very effective there. That's what the Food and Drug Administration has really approved them for so far.
Right.
So I want to make sure we're clear on that, because patients who have, as noted in the video, an LDL above 190, who have a very prominent family history, father, mother, uncle, brother, heart attack at age 40, that's when we want to worry about it. They need to see a physician and get a diagnosis. You're asking a much more global question about what might happen if the new drugs prove effective, and I think most of us are quite optimistic they probably will in terms of reducing the risk. Question will be, for who? For all patients already on a statin, or for a small fraction of those already on a statin, and how do we sort that piece out? I'm no healthcare economist by any means. The current price tag is exceptionally high. The good news is 3 different companies, and potentially as many as 5, may have products in this arena relatively soon, and so hopefully competition will bring us to a issue here. I will say, and I'm interested others say, that this is probably an area where maybe for the first time we're going to see the payers really exert their influence here as much as the physicians and the patients. And that's going to be an interesting twist for the story.
And we have seen some competition bringing discounts, larger discounts, but are you worried about, if we decide down the road that a wider group of patients would benefit from these drugs, that there will be limited access because of the excessive price?
Well, I think, Bill, it's only realistic to project in the short to intermediate term that there could be restricted access, and that's not to say that it would be wrong to restrict access in the short to intermediate term. There's a lot of hope about these particular medications. It should remind us of the similar hope that we had regarding other medications in the past that did not pan out to convincingly reduce event rates, rather than a surrogate marker like cholesterol or in other cases CRP, which is a different conversation. But as Paul very carefully points out, assuming all of that homework is done and these medications that dramatically reduce cholesterol levels are found to provide incremental value, then I think the conversation is engaged. But it should start from the perspective of what are the patient populations for which these drugs are most effective with respect to reducing event rates.